Hey, it's Alicia from mobilitymastery.com, and if you have plantar fasciitis, so if you have pain on the bottom of your foot, like in the arch or in your heel, or any type of foot pain down here, even if you haven't labeled it plantar fasciitis, this video is for you. And what I want to show you today and talk about is the difference between an acute cause of pain and the root cause, and then acute relief that you can get versus eliminating pain at the source so you never have to experience it again. So I've put out quite a few videos here on Mobility Mastery about plantar fasciitis, and there are a few really amazing ways to get it, to get some relief right away. So I've released some calf fascia release videos and some hamstring fascia release videos before, and I'm actually going to be doing those in this video. So if you've never seen any of my videos, if you're landing on this video and it's the first time watching any of my content, first of all, welcome, and I'm glad you're here. But I am gonna actually show you two things you can try right now, today, if you happen to have these tools, a foam roller and a softball, to get some acute relief from plantar fasciitis. But it's critical for me to feel good about everything I'm doing here on the internet, helping you solve pain at home, to help you understand the difference between getting some immediate relief and ending up in pain management versus finding the root cause and getting rid of pain for good. Because I want you to get rid of the pain for good. If you have plantar fasciitis, movement becomes extremely difficult and challenging because just about every human movement that we do, not all of them, but most of them, we're on our feet, right? So running, hiking, working out in a gym, CrossFit, Olympic lifting, biking even, you're kind of using your feet. Swimming may be the only thing where you're not using on your feet, but you're definitely still using some muscles that could contribute to plantar fasciitis. So it can be extremely debilitating. And for the most part, the common treatments that are out there available to you from the Western medical model target only the feet. So we're talking about cortisone injections in your foot, rolling your foot at the bottom of your foot on a frozen water bottle, resting it, icing it, right? Even if it's not a water bottle, just putting ice on it, maybe immobilizing it with some tape or a brace or a boot, which is really going to immobilize the foot. And what all of these theories about plantar fasciitis and treatments do is isolate the foot from the rest of the body. But your foot is part of your entire body. And so the very first thing we need to do to understand plantar fasciitis is to actually go upstream. And we're going to look at the calf fascia and the hamstring fascia as they're involved in plantar fasciitis. So right now, before we actually do anything on the floor, where I show you some foam rolling or fascia release on a foam roller and a softball here, I want to know if you have pain on only one foot or both feet. So most people who have plantar fasciitis experience it in only one foot, or it starts in one foot and it's in only one foot for quite a while, and then maybe you end up with a little bit of plantar fasciitis in the other foot, and then it kind of ping pongs back and forth between the two. It's very rare for people to have bilateral plantar fasciitis on both feet. That's equally as painful. So if that's you, you're in kind of a rare situation, and you may not need to go all the way to the root cause I'm going to talk about today, which is pelvic instability and glute inhibition. So we're going to come back to that in a little while, but the classic telltale sign to me that plantar fasciitis is caused by pelvic instability and glute inhibition is when it shows up in only one foot. So just ask yourself, why is your body giving you a pain signal in only one foot? Well, we're pretty asymmetrical creatures, right? We lean on one leg. A lot of the time we have a strong leg. We have maybe more stability. We feel more stable on one leg if we go to try to balance on only one foot, for example. So it's really common for humans to be kind of zigzaggy. But what this does, this kind of zigzaggy stuff on an anatomical physiological level, is potentially throws your pelvis out of alignment. But the human body is amazing at compensating. So it's going to compensate until it can't anymore. And when it can't anymore, that's usually when you get a pain signal. And there are signs that, your body needs help leading up to the pain signal, but most of us aren't paying attention at that level to those lower level whispers that the body gives us. So I want you to know that no matter what type of plantar fasciitis or foot pain you're experiencing, if it's on the bottom of your foot or in your heel, everything I'm talking about today applies to you. So let me define the difference between acute cause and root cause, and then acute relief and solving it for good so it doesn't come back. So all the videos that I've put out so far on Mobility Mastery, the YouTube channel here and the blog, for plantar fasciitis or heel pain have predominantly been calf fascia release techniques of various kinds. I have quite a few of them, as well as some hamstring fascia release techniques, and I have a few of those. And those are the acute cause most of the time of plantar fasciitis, but they're not always the root cause. So that's why I'm here today to talk to you about both. So a lot of you I know, I've talked to you by email. Some of you have been with me a long time, and years ago we might have done some Skype sessions. And what I consistently hear from people is they can manage plantar fasciitis really well with my calf fascia release techniques and hamstring fascia release techniques, but they're not necessarily eliminating it for good. Some people are eliminating it for good with just those. But the telltale signs that you're in pain management are if you have to keep coming back to calf fascia release techniques and hamstring fascia release techniques over and over, and those areas seem to tighten up more than other areas of your body. So if you are really reliant on your foam roller and your lacrosse ball or softball to stay out of pain, and you're fairly consistently having to do fascia release to stay out of pain, then you're probably in some kind of pain management scenario. Now, it's totally normal that we have to actually manage feeling good, and fascia release definitely requires maintenance. So maintenance, though, is a different scenario to me. Maintenance to me means I'm being proactive about the fascia release I need to do, and I'm not feeling any pain. So if your plantar fasciitis keeps coming back, meaning the pain comes back even just a little bit, and then you can get it gone with fascia release, and then it comes back, and you can get it gone, and then it comes back, and you get it gone, you're in pain management. If you can get it gone and keep it gone with fascia release, you're in maintenance. So you may not need to listen to the rest of this video, which is going to be about pelvic instability as it relates to plantar fasciitis. So before we get there, though, I'm going to show you the acute cause and acute relief areas that you want to look at for getting some immediate relief. Because if you're landing on this video, maybe even for the first time seeing my content, I want you to get some immediate relief if possible. And I would hope that you are listening to everything else I'm saying so that you can potentially solve it at the root level if you need to. So calf fascia and hamstring fascia tighten up, causing plantar fasciitis. Why? So my formula for finding the root cause of pain is always to ask why until I can't anymore. And usually when I can't, we've landed on some kind of end point. So let's say you have plantar fasciitis in only your left foot. Then you might target your left calf or your left hamstring. And maybe you even try doing some fascia release on your right and it just doesn't feel as intense. It doesn't feel as necessary. Why are these two areas so tight? And why are they tight only on the left side? That's kind of the question we're going to get to. But you can get acute relief by going there. So I want to show you those two things before we move on and talk about pelvic instability. All right, so I want this to be an interactive video, so I hope you're following along. Grab your foam roller, and I'm gonna have you put your calf on the foam roller, whatever side you're feeling plantar fasciitis on right now, and we're gonna release it and see what happens for you. But what I want you to think about is, when you isolate the foot, in the case of plantar fasciitis, thinking that the foot is the problem, you're not addressing any part of the root cause. So while I'm not necessarily calling the calf fascia the root cause, it's part of what will lead us there, and it's far better and more effective than isolating the foot. So what usually happens in the case of plantar fasciitis, what is it? Plantar fasciitis. It's the plantar fascia is inflamed. That's why they call it the itis, right? So anytime you have an itis, tendonitis, bursitis, we're talking inflammation. So it's inflammation on the bottom of the foot. Why is it inflamed? Well, usually it's getting pulled on or irritated or not getting blood flow from something upstream, and your calf is going to be a big part of that. So to start to experiment with what's going to get you relief, this is the closest thing that is not the foot that you would want to explore, is your calf. So you're going to come up like this if you can, and rock side to side. You can see if you can go all the way to the middle and all the way to the outer edge. For most people, it's going to be right in the middle or to the outer edge. So that's, you just kind of want to start exploring. Now, you can definitely explore all parts of your calf. So I have a fascial adhesion right there. It's clunking a little bit. Those are the things that you want to hunt out for relieving plantar fasciitis. So those knots end up, like if I were to pull my, pants here into a knot, you can see how it might actually pull on the Achilles, maybe the heel, maybe the foot. So we're looking to hunt out those knots and release them. So we're going to increase blood flow to the foot, increase water content, right? And cellular hydration. We're going to increase collagen production, hyaluronic acid production, and basically give your body what it needs to heal and repair anything in the foot, because inflammation is a sign that the body wants to isolate an area for nutrients, to get nutrients into that area so it can repair at the cellular level. So you want to make sure you're hunting out those clunks. So I want you to go really slow. Today, all we're doing is exploring acute cause, root cause, and what can get you relief right now and what will get you relief long term. So this isn't a complete walkthrough, but if you want to be walked through these techniques and additional ones, you can search the channel for all the calf release techniques that I have, as well as the hamstring ones. So you would explore everything in the calf from the knee down to the ankle. Now, if you want to make it more intense, you can put that foot on there, give a little bit of compression, and just going back and forth is going to be pretty effective, but you can also point and flex your foot and rotate and see if that does anything. But if it hides the clunk and you're just kind of like rolling on the roller, I would actually prioritize whatever will get the clunk. So pointing and flexing kind of does it for me, but this is actually better. And I can tell if I go even a little bit further down, I'm really going to get it there. So those are the things. It's, most people, what I see is adhesions from kind of the middle, where the calf is the thickest, down into the Achilles, which is usually where those knots are. And those are the areas you want to try to release to see if it's going to get you relief for the plantar fasciitis. Now, some people with heel pain, like heel-specific plantar fasciitis, can get relief from a calf release technique. But what I have seen is that most of the time, the calf release techniques are the most effective for people with plantar fasciitis on the bottom of the foot. There's a big fascial connection between the calf and the bottom of the foot. And if we're talking heel pain, you would want to actually go to your hamstrings and explore that. So again, this isn't meant to be like a full solution for plantar fasciitis here. We're exploring together, seeing what kind of relief you can get today. So if you just did this with me, I would want you to spend 30 to 40 seconds on every spot that you find, going all the way down. So you might find 1, 2, 3, 4 spots in your calf and down into kind of the Achilles. Spend 30 to 40 seconds per spot, and don't move on to the hamstring yet. So if that's you and you're actually following along and you tried it just now, I want you to actually get up, walk around, and check in with your pain. Did it change? Does it feel better? Did it change location? Did it change sensation? If it was a 4 out of 10 when you started, what is it now? I didn't have you rate it before we started. So if you're just watching this video right now and you're planning to do it later, rate and re-rate your pain before you start. That way you're going to have a gauge of how much relief you can get from just releasing your calf fascia. Then you want to stand up, walk around before going to your hamstrings. So if you happen to have a softball, which any of you who've followed me for a while should have in your toolkit, then we can explore some of this hamstring fascia and see what kind of relief you can get there. So a great place to start is just the belly of the hamstring. And if you have pain in your foot, that's a little more lateral. So if it's on the outside of the heel or the outside of your foot, instead of the arch or the bottom of the foot, you could rotate that ball, or you actually, to the outer part of your hamstring and IT band junction. That is actually a huge contributor to heel pain, especially heel pain that's on the outside. But you want to explore the center as well. So I'm just shifting my hips to explore this fascia. I'm trying to let most of my weight land on the ball. You could try a little back and forth, but I like cross-fibering those tissues here. So I like going this way on tissues that run from my hip to my knee. And again, just kind of rolling into that IT band side. You can get all the way up towards the glutes and get in there and see what happens. And similarly, so again, I'm not walking you through the whole thing right now. You can find a spot, do it for 30 to 40 seconds, find the next spot, 30 to 40 seconds. You don't want to make this a rushed, just rolling things out experience without actually tuning into what you're feeling. You want to hunt out adhesions, like that's your job if you're, trying to do fascia release for pain relief usually. So this will work great. You could also use the lacrosse ball. So I have other techniques on the site, totally free, using the lacrosse ball. You could try those for the hamstrings as well. The hamstrings are a little harder to get into effectively on your own than the calf, but you can. So just be patient and know that you're hunting out sensation that feels intense or tender or sore, or those adhesions. So those are kind of like the things that you're hunting and looking for. And if you're curious, I would encourage you to actually test the side that you have pain on versus the side you don't. And just see, is that other side as intense, as sore, as tender, as painful, or not? A lot of the time it's not. So that's just always kind of interesting. And it's you learning about your body and learning about imbalances you have left to right. And that's going to help you ultimately solve this at the root level. So where the hamstrings are concerned, with heel pain, we've got a huge sheath of fascia here that runs deeper into the posterior part of your body, that connects a bit more to the heel than the bottom of your foot. But that whole line is also fascially connected. But these are my two go-to places to start to get immediate relief for plantar fasciitis or heel pain. But I want to talk now about solving this at the root level, which involves pelvic instability and lack of glute activation, or something called glute inhibition. And specifically, we're going to talk about gluteus medius. So I want to really help you understand how this is involved in plantar fasciitis, and then invite you to do a deeper dive with me on understanding and solving pelvic instability. All right, so what does plantar fasciitis have to do with this thing called pelvic instability or hip instability and potentially a glute muscle not firing or glute inhibition? Well, let's actually go back and start at the beginning and trace our steps back to the root cause. So your foot is hurting, your arch is hurting, or your heel is hurting. You have plantar fasciitis, maybe someone diagnosed you with that. And if you're following me and you tried what we just did, maybe you found out that you have some fascial restriction in your calves or calf on the side that's hurting and your hamstrings. Now, we're going to use my formula of asking why to follow this all the way back to the root. Why are the calf and hamstring tight? Especially, why are they tighter on that side? If you actually went to the other side and tested and found out, in fact, they are tighter on the side that you're having pain. Well, one potential reason is that those muscles are compensating, or you're in some kind of compensation pattern. But what, right? So what would the calf and hamstring be compensating for that would make it tighten up more on that side? Well, I've discovered in my private practice that a lot of the time it comes back to this thing called pelvic instability, but we're not quite there yet. First, we have to talk about glute inhibition. So one of the main causes of compensation in the lower body is going to be your gluteus medius specifically not able to fire on command. It's inhibited. It's not necessarily working for you through movements like walking, even standing, hiking, running, working out at the gym, you name it. All of those movements require hip stability or glute activation and pelvic stability. So if your gluteus medius isn't available, why? I've found that most of the time there are two main causes for glute inhibition. One is going to be pelvic instability, and the other is that the glute is actually inhibited due to something called reciprocal inhibition. And those two things can actually overlap. So you can be in some kind of reciprocal inhibition scenario where your glutes aren't firing, which leads to pelvic instability. And then the cycle kind of keeps going. But what is reciprocal inhibition? Reciprocal inhibition is just an anatomical law that means opposite muscles in the body inhibit and facilitate each other's movements. So for example, if I wanted to contract my bicep here, my tricep has to stretch. If I want to contract my tricep, my bicep has to stretch. Those are examples of reciprocal inhibition in motion. Now, regarding your hip, the gluteus medius can be inhibited by your hip flexors. In particular, your quad hip flexors and your adductors. Those are the two primary parts of your body that will actually inhibit the glute from activating. Why? They're so overused and so tight and short that they can't stretch enough to allow the glute to actually contract like it needs to. So the glute, especially gluteus medius, is involved actually in internal and external rotation of the hip. It also extends and flexes the hip, or helps in those movements, and it's responsible for deceleration through the swing phase of gait, aka walking. So the gluteus medius is our primary hip stabilizing muscle. It can do all kinds of things. Actually, it's fascinating to me that this one muscle can do opposing movements like hip flexion and extension, or internal and external rotation. It just depends on what part of the gluteus medius is getting activated. And if you lose the ability of that glute to activate, you've lost hip stability. You've lost your primary hip stabilizer. So what happens when you've lost your primary hip stabilizer? Well, this is gonna take us to maybe some of the activities that you do, because what your body chooses to compensate with is gonna come down to your lifestyle habits, your activities, maybe some anatomy of yours, and prior injuries and other compensations that are compounding all of this and making it somewhat complex. But let's talk about simple, basic human movements. Standing, so just standing on your 2 feet, walking, and maybe hiking or running. So these are like, common human movements that most of us perform. If you don't have glute activation through these common human movements, your foot could potentially start gripping the ground to stabilize you through these movements, which can result in tightening up your plantar fascia. It tightens up your calf, especially your outer calf, to do that. And that's one reason your calf fascia can tighten up only on one side. If we take this example to more complex movements, if you're a CrossFitter, for example, or you work out in a gym and you do a lot of, say, lunging or squatting or deadlifts, right? Things that require hip stability and that glute activation, your foot is gripping the ground, maybe only on that one side, while you do those movements, and it's tightening up the bottom of your foot again and that calf fascia. So that is the primary reason your calf fascia is going to get really tight in the case of glute inhibition through certain human movements. Why would the hamstring get tight? Well, it's been my experience that the hamstring is actually going to kick in and get involved in conjunction with the IT band a lot of the time. Not always, but a lot of the time they're actually working together to stabilize you laterally. So they're trying to work over time to provide stability through movements, probably like hiking and running. Running specifically, I would look. So if you're a runner and you have plantar fasciitis, I would definitely check out your hamstring IT band junction, like I showed you earlier on that softball. And if that is really tender and really tight, you have the classic signs to me of glute activation not working for you on that side. And it's that fascia on the lateral part of your body that's actually kicking in and working overtime to stabilize you through these upright dynamic movements like hiking or running. The other possibility here with the hamstring is that potentially your brain has commanded the hamstring to tighten up to keep you stable if you're in pelvic instability. So now we're kind of coming to this big topic of pelvic instability, and you're watching this video because you have plantar fasciitis, but maybe you also have other issues and it's not just plantar fasciitis, or maybe just really curious about the human body. But pelvic instability can actually contribute to knee pain, medial knee pain, lateral knee pain, low back pain, hip pain, and even shoulder pain and neck issues, as well as mid-back pain and other things. So this one thing, pelvic instability, is involved in all kinds of pain issues. Why? Well, it's the center of the human body. So it's what divides us between our top and our bottom, right? So legs and upper body. And here's what I really want you to hopefully understand about tracing this all the way back to the root and why your body would do this. It's not doing it to you, it's trying its best to keep you alive. And what the human body needs to stay alive is a healthy central nervous system. So the CNS, central nervous system, lives inside our spinal cord, and it runs, from the back of the neck, through the cervical spine, through the thoracic spine, and all the way to your tailbone, to the lumbar spine. And if you don't have a functional central nervous system, your body can't communicate to your brain, and your brain can't communicate to your body. And if that is compromised, you could lose function and die. So your brain has to communicate with your body to tell your heart to beat, for example, or to tell your lungs to keep breathing. So, I'm sure you've heard of examples of people becoming paralyzed because some part of their spine was, broken or severed in some way, ultimately very, very compromised, and they lose function below that area, often in the cervical spine if there's an injury there. So the brain will do anything to prioritize a healthy central nervous system. That means your spine. And your spine sits on a base, that is your hips and your pelvis. So if that base becomes destabilized for any reason, your body will first do whatever it can to compensate, but then it can't compensate anymore, and that's when you get a pain signal. And your body's not trying to punish you, it's not annoying you, it's saying, excuse me, I need some help. There's something off and wrong, and I need your help to fix it so we can move on with life and do, what we want to do. So whether you're a hiker or a runner or a gym goer, yogi, and you have plantar fasciitis, you can definitely use the techniques I gave you today and go after that calf fascia and the hamstring fascia and get some acute relief. But if you suspect pelvic instability is at the root of your pain, then you have to solve pelvic instability first to get rid of that pain for good. And otherwise it's probably going to keep coming back, or maybe your body will start compensating in other ways. And if you don't know how to address, your entire fascial system, because everything is connected, you could throw yourself out of balance by only focusing on the side that hurts. So it's actually really important to look at the body as a whole and look at how these muscles and the fascia in those muscles are interacting with each other to either keep you stable or compensate for some type of destabilization. So I hope this is making sense. And I know I haven't fully gone into, what causes pelvic instability, right? So if we're going to keep asking why, it's like, why is the pelvis unstable? Well, the short answer is it's typically destabilized due to imbalances left to right in the legs, specifically the thigh fascia. So I'm talking big muscle groups like your quads, your quad hip flexors, your adductors, your IT band, and your hamstrings. And those areas, when thrown really out of balance, for example, if you, a really good example I could think of is someone like a soccer player. If they are constantly kicking with the right leg and tightening up the right quad and kind of overusing the right quad and oftentimes, not using the left quad as much, it can throw that pelvis out of alignment in such a way that something compensates, maybe the glute gets inhibited, and you wind up in some kind of compensation pattern for a destabilized pelvis. But there are all kinds of ways that we can throw our body out of balance, even if you're not an athlete. So these are things like leaning on one leg, always using one leg, like your right leg, let's say, to step up onto a rock if you're hiking. So we have preferences, right? It's the way we sit, it's the way we stand. Maybe, you're in the gym lifting a lot of heavy weight and you always shift a little bit to the right side to stand up. And those things can, over time, accumulate, causing a pretty big imbalance and then causing your brain to suspect that the spine is in danger. It's going to compensate first before giving you that pain signal, usually. So that's really what I wanted to share with you today. And if you're interested in learning how to solve pelvic instability and learning a little bit more about this thing called pelvic instability and how to really think about problem solving it so that you can get out of pain for good, I have a free training that I'm offering called Solving Pelvic Instability, and you can find the link to sign up for that in the description below this video. All right, so I hope this helps you understand how to get acute or immediate relief for something like plantar fasciitis and heel pain, but also how important it is to trace it back to the root cause. Now, what I want to leave you with before we close out today's video is just some food for thought on how ultimately in the long run, not healthy or potentially even damaging some of the common treatments for plantar fasciitis can be because they don't address the root cause. So if you, for example, start taking painkillers to deal with it, your compensations can get even worse. The pain signal isn't registering in your brain, but you're still compensating a lot. If you get a cortisone injection in the bottom of your foot, you not only run the risk of dealing with some of the potential side effects of cortisone injections, which I have a video on if you want to really learn about that, but you potentially have killed your pain receptors there, so you're not feeling the pain anymore. But there can ultimately be some damage in the long run, potentially, from that cortisone injection, and you haven't taken care of either the acute cause or the root cause. If you decide to wear something like a boot or you immobilize your foot, then you're not actually getting blood flow to the part of your body that needs blood flow the most, and you're thinking that the foot is the problem and you're not actually taking care of anything upstream. And when you take the boot off, oftentimes you're going to compensate even worse, or you might compensate while you're in the boot with your other side. So there are just so many reasons not to go for the common treatments that look only at the foot. I want you to think about plantar fasciitis and your foot as part of your whole body, and the whole body is working together to work for you the best it can with the ingredients that you've given it with your lifestyle and your sports and your habits and the way you sit and the way you stand. And fascia release can do so many things for you, from getting you that acute relief to helping you actually find the root cause, take care of that, and not have to actually feel this pain anymore. So I hope you enjoyed this video. I hope it was useful for you. And again, if you want to learn more about pelvic instability and take a deep dive with me on that, then I look forward to seeing you in my free training. But for now, I'd love to hear from you below this video. If you tried the acute relief techniques that I gave you, or any of my other ones for calves and hamstrings, I'd love to know how those worked for you. And I'd especially love to hear from those of you who suspect that pelvic instability and glute inhibition is at the root of your plantar fasciitis, because I'd love to help you solve this for good. So tell me if you think that that's the case below in the comments. And thank you so much for watching. I'll see you next time.